the federal government, both Liberal and Conservative, have been consistently for decades cutting transfers to healthcare.
So right now in Canada, long-term care homes are facing the brunt of COVID-19 deaths, with 82% of deaths from the coronavirus in long-term care homes. So with this being such a massive issue, NDP leader Jagmeet Singh challenged Justin Trudeau to his face on this issue. So let me show you the clip here.
80% or more of the deaths during COVID-19 have been seniors living in long-term care homes. The military had to be called in. Out of 14 countries, Canada has been deemed the worst in its care of seniors. Despite all of this, the Prime Minister has said recently that he doesn't feel it's the federal government's responsibility to find a solution. How can he say that to families reeling with the loss, that it's not the federal government's responsibility to play a role in solving this problem?
Right Honourable Prime Minister.
Mr. Speaker, perhaps the fact that the NDP no longer has many seats in Quebec has caused it to forget the importance of respecting the Constitution and the areas of jurisdiction of provincial versus federal governments. We will be there to work with the provinces as they deal with challenges in their long-term care facilities. We are there as a partner, but we on this side of the House will always respect the jurisdiction of the provinces and be there to support them in fulfilling those responsibilities.
Everyone across Canada has just heard this Prime Minister double down on the idea that he doesn't feel it's his responsibility, despite the fact that the Canadian military had to go into long-term care homes. There is a role that the federal government can play. The federal government, both Liberal and Conservative, have been consistently for decades cutting transfers to healthcare. They can increase those transfers to ensure that long-term care is adequately funded. We can also ensure that there's a national care guarantee, working with provinces to ensure that we are meeting the best standards. We can increase workers' pay. We can ensure that there's no more profiting off the back of seniors when it comes to long-term care. Will the Prime Minister commit to some of these care guarantees?
You right Honourable Prime Minister.
It will come as exactly no surprise to the vast majority of Canadians that the Liberal Party will always stand up for the Constitution of Canada. We respect the Constitution, we respect areas of provincial jurisdiction, but as I have said from the very beginning of this crisis, we will be there to help the provinces as they manage the challenges that they're facing. The federal government does have a role to play, and it is a role to support the provinces in doing the things they need to do during this unprecedented time.
All right, so Justin Trudeau there, as he often does, very slyly skirts the issue, acts like his hands are tied and there's nothing he can do, and takes shots at the NDP for not having as many seats in Quebec. Now, yes, healthcare is managed by the provinces, but there is a national standard in terms of the Canada Health Act. I don't see any reason. Maybe there's a reason for this, but I don't see any reason why long-term care can't be folded into the Canada Health Act to ensure that there is a national standard when it comes to long-term care homes. Because a lot of the issues in long-term care are in private facilities. Now, yes, public facilities also have issues in long-term care, but a lot of the biggest issues are in private or are in for-profit care. And a lot of the nurses working in these long-term care homes are being paid less for the same job that nurses do in hospitals. And so because of that, they're working in multiple areas, which also has helped to spread the virus around to all these different long-term care homes. So there has to be some kind of real national standard here when it comes to long-term care. And I think also taking private interests out of it would help the situation as well. But part of the issue is, in this clip, I like that Jagmeet Singh was going after Trudeau here, but I think he should have been a little more direct in terms of how Trudeau was misconstruing reality and acting like there was nothing that he could do. What Trudeau could be doing is taking a leadership role here and bringing the provinces together and actually fighting for some kind of real standard nationally. Now, so I just think there's more that can be done here that isn't really being explored by the Liberal government. But at the same time, as we've seen so far, the Liberals have been influenced by the NDP when it comes to their response to coronavirus, be it on the $2,000 a month. It's not a UBI like the NDP proposed, but the Liberals still took the $2,000 a month and made it essentially means tested it and turned it into the CERB. So they have that idea taken from the NDP. the 75% wage subsidy, that idea taken from the NDP, expanding EI benefits taken from the NDP. I'm not saying this to attack the Liberals. I'm glad they're taking these ideas. But this is another one that they should be taking, as clearly the biggest issue here with COVID-19 is in long-term care. And to not take this seriously and look for a different approach to addressing long-term care, I don't think the Liberals are really going to be able to get any meaningful change in long-term care unless they take a bolder approach to this issue.